Hey, everybody. So welcome up. I know that I am 10 minutes late tonight, but that's because by the time I finished getting everything ready, it will not let me start I have to like schedule it 10 minutes in advance. So I was ready at 8, but it wouldn't let me do it at 8. So that's why I was not able to be right on it at 8 o'clock. So come on in here, say hi. I'm going to share this broadcast to my personal page real quick for those that normally watch over there. Hey, Mindy B. Today has been another very busy day. And I am going to pop into this live real quick, get it shared over to my page, and then we'll be ready to go. All right. If you follow me on Twitter, you already know what's happening. What's up, WJ? I haven't seen you in a minute. Hey, Christy. So if you follow me on Twitter, you've probably already seen my tweet and you've already seen a little bit of the video that I'm going to share tonight, but we're going to talk about it a little bit more in depth. Hey, Renee, how is everybody? Y'all doing all right? Hi, Kelly. Hi, Kelly. I know some of y'all thought you'd gotten rid of me, huh? But it's definitely been a very busy day. So, if you all live in the Ballad Health Service region, you probably saw their news conference today and the news broadcast today. Hey, Denise. Hey, Teresa. Where they are basically saying, hey, listen, we have declared a staffing crisis, and the CDC has created some new guidelines to mitigate crisis staffing in healthcare systems. And so that's what Ballad Health said they were going to do today. It has been a very long time since I have said these words in relation to Ballad Health and Alan Levine. But let me just say, today's yummy goodness time. And the reason why is, you don't have to do much to catch them. You don't have to do much. All you have to do is listen. And sometimes you're listening for what's being said, and sometimes you're listening for what's not being said. And today I was listening for both. And so what caught my attention about this new crisis staffing guidelines from the CDC. So first of all, of course, I was able to see the emails. I've even seen the emails with regard to employee vaccinations, which I would love to go into that tonight, but I don't think I'm going to have time. I'm just going to stick to one thing, and then maybe I'll do another broadcast before Tuesday. Okay. Thanks, Jody. Appreciate that. You never know. I got ready in literally 25 minutes. But okay, so let me just back up. So on January 21st, the CDC came out and said, listen, we recognize that with the Omicron variant that, some hospitals are having a really hard time staffing. Hey, Cam, how are you? And so they've come out with these guidelines that said, hey, listen, we had some contingency guidelines. Now we've come out with crisis guidelines. And, and if it comes down to it, we've got to make sure that we have healthcare workers in these facilities to take care of people that need being taken care of, right? Which, got it, cool. I want to point out a couple of different things, though. Okay, so first of all, let me just say this. Hey, Charlotte, how are you? So let me just say this. As you all know, after much hesitation and consideration, I am for getting vaccinated. Okay. I don't know if you guys have done the numbers, but in the Ballad Health Service region, since COVID started in March of 2020, we have lost in the Ballad Health Service region 3,799 people. If you remember, I did a broadcast several weeks ago, and I was comparing the number of people in the region that had died for Ballad Health compared to, say, Mecklenburg County and Charlotte, North Carolina. And the reason why is because the population size of the Ballad Health Service region is almost the same as that of Mecklenburg County. They're both 1.1, 1.2 million people, okay? The number of cases that they had were within 100,000. I mean, they were not 100,000. They were within a few thousand of each other. And even looking at the poverty rates, Sullivan County and Washington County, which are the most populous of the Ballad Health Surgery region, their poverty rates are right along the same lines, not too much higher than Mecklenburg County. And when we were talking about this, we talked about like the reasons for this, the differences in how death certificates are attributed to COVID patients and so forth and so on. But what it amounted to was the number of deaths in the Ballad Health Service region was 2.5, almost 3 times more than Mecklenburg County. And while there might be a variety of factors for that, the bottom line at the end of the day was that with numbers that were that significant, if I have a population that is almost the same size, if I have the number of positive cases that are almost the same size, and I see a significant disparity in the death rate, if nothing else, that's a sign to pay attention. So I covered that a few weeks ago, right? And I want to point this out. So when we talk about this vaccination thing, you've seen Alan Levine testify in front of Congress, and you've seen him send an email off to CMS saying they have done everything to make sure that employees get vaccinated and all of this stuff and how pro-vaccine they are. The issue I have with that is, like, today he said they were going to be very liberal with religious exemptions and things like that. And there's a disparity. I've seen another disparity in the numbers. So I'll give you an example. In the letter to CMS, that's the Centers for Medicaid and Medicare, right? Because 70% of the people that are in Ballad Health hospitals are on Medicare, Medicaid, TRICARE, right? And in that letter that he sent to them asking, oh, wait, not this one. I don't want you to have that one yet. Sorry, I got a lot of stuff pulled up here. He said that Ballad Health, prior to the pandemic, had a 15% turnover in their workforce. That's what he said. And that it was below the national average. That's what he said. Do y'all remember this? This is his letter, as you can see. And he said that when he was testifying in front of the congressional subcommittee in October 27, 2021. That's what he said. 15% prior to the pandemic. Look, before the pandemic began, our annual nursing turnover rate was 15%. That's what he said. But that is not what Ballad Health told Modern Healthcare's reporter when she came down to cover the protest. Nope, that's not what he said to her. What he said to her was they didn't turn over the data. They didn't turn over the data to Modern Healthcare, but what they said was, look, as of June 30th, 2019, this article came out September 30th, 2019, that the turnover rate for nursing was 17.2%. They said in July of 2018, it was 21.6%. Okay. But so Alan Levine testified in front of Congress that the nursing turnover rate prior to the pandemic was 15%. But what they told Ballad Health, what they told Modern Healthcare in September of 2019, shortly before the pandemic, was that the nursing turnover rate was 17.2%. Okay, let me show y'all this. And I'm going to give you the link to this article. Let me just go ahead and give it to you now. Here is the link from WJHL's website where his letter is to CMS requesting for the exemption to the vaccinations. And here is a link to the article with Modern Healthcare, right? I'm going to give you both. Now, what's also interesting is I went back to see what Ballad's own numbers say. What did Ballad say in their annual report? Well, in their annual report to the Department of Health under the COPA, here's what they said. They said from July 2018 to the end of June 2019, their annual turnover rate for the entire organization was 21%. So at a minimum, here's what we know. The entire organization had a turnover rate of 21% by mid 2019, before the pandemic began. We know that at least 17.2% of that was from its nurses, according to what they told Tara Benow at Modern Healthcare. Y'all see that number right there, 7.2%. Okay. But what we know is that Alan Levine testified and told Congress, and he told the Centers for Medicaid and Medicare, that before the pandemic, their nursing rate was 15%. All I know is they don't turn over the data. because of the laws that the politicians passed, they don't have to turn over the data so that we actually know what numbers are correct. But we know there's a disparity in the numbers. Okay. That's not even the part that you ought to be concerned about. Okay. So what happened today is they said, listen, the CDC has rolled out these guidelines. And basically, this was updated on January 21st, okay, of 2022. And the CDC said, listen, we recognize that, hospitals are having a hard time. Teresa, I don't know who they're including and who they're not including in that data. And they're not sharing the data, so no one knows who they're including. I don't know. But here's what we know. And so they are now allowing staff who have tested positive for COVID-19 to return to work with some restrictions depending upon if they're vaccinated, if they're not vaccinated, and in what areas they're going to work in. Okay. Now, here's why that ought to concern you. I listened to Alan today, and I love it when he talks, just like when he did for 60 Minutes, because inevitably, he puts his foot in his mouth. So I'm going to share with you what he had to say today. So pay attention to this clip, and then I'm going to point out something that that I caught today when I went back looking at the CDC's guidelines. Okay, here we go.
Will not be able to work in places like our oncology units.
Hold on, let me go back.
Part of this is there are so many other patients who need services that we have to take care of. It's our responsibility to take care of them. And one of the things we had done before, we've done it twice. First time it was imposed on us by the government. The second time we did it voluntarily was deferral of elective surgeries. And what we feel strongly about, having discussed it as a team, is that deferring elective surgeries is the last thing we want to do. The word elective seems to imply to some people that these are surgeries that aren't really necessary, but that's not true. These are patients, some of whom have cancer, some of whom have serious orthopedic injuries, including Eric. These are patients who need these procedures, that need this care. And so this time we've made a decision that we are not going to defer elective surgeries if we can avoid it. And so where does that leave us? Well, we've got to figure out how to get staff back to work.
So now is when he goes into talking about this chart right here and how they are able to how they're able to bring back employees who have tested positive, right? And how to bring them back into the workforce. But I want you to hear something that he said. Pay attention and stay with me, folks, because his whole thing is we have declared we are in a crisis for staffing and we're going to implement CDC guidelines. Well, first off, I want to point out to you what the CDC says about these crisis guidelines. It says, and I'm reading from their website, I will give you the link. It says, when staffing shortages occur, healthcare facilities and employers, in collaboration with human resources and occupational health services, may need to implement crisis capacity strategies to continue to provide patient care. When there are no longer enough staff to provide safe patient care, these are the things that you can do. And this is what they're saying. So listen, the only way that you can implement these new restrictions, these new guidelines, is if you can no longer provide safe care. So the first thing that you need to understand as the public is that when Ballad Health says we are adopting CDC crisis staffing guidelines, they are saying that they can no longer provide safe care without them. I need y'all to pay attention because this is important. Listen to what the CDC said. When there are no longer enough staff to provide safe patient care, because what I wanted to know is what constitutes a crisis. Well, according to the CDC, what constitutes a crisis is not being able to provide safe care anymore. That's what the CDC said. Okay? So by Ballad Health saying we're adhering to CDC guidelines, right? And by Ballad Health saying we're in a crisis, they're saying we can no longer provide safe patient care. That's the first thing you need to note. The second thing is to listen to what he just said a second ago.
We've
right here.
These are patients who need these procedures, that need this care. And so this time we've made a decision that we are not going to defer elective surgeries if we can avoid it.
So pay attention. We are not going to defer elective services. Did y'all pay attention to what he just said? Well, let me tell you what, the CDC says, no, you can't do that. Listen, here's what the CDC said. It says, look, here are the key points to take away from this new update. It says maintaining appropriate staffing in healthcare facilities is essential to providing a safe work environment for healthcare providers and for safe patient care. Maximizing interventions to protect healthcare providers, patients, and visitors are critical at all times, including when considering strategies to address staffing shortages. And this one is the one you want to pay attention to. CDC's mitigation strategies offer a continuum of options for addressing staffing shortages. Contingency is first, followed by crisis capacity. Strategies augment conventional strategies and are meant to be considered and implemented sequentially, i.e., you have to implement contingency strategies before crisis strategies. You cannot just say, oh, I'm going to skip to crisis. You can't do that. You have to do everything the CDC says is for your contingency first. So what does contingency say? Well, let's take a look, okay? So you got to do contingency first. Well, if you look on the CDC website, what it actually says is contingency right here. The very first bullet point under contingency capacity says cancel all non-essential procedures and visits. But wait a minute, Alan, didn't you just say we are not deferring elective surgeries? We're not going to do what you say, CDC, but we're going to tell everyone that we're able to do this because you came out with crisis staffing mitigation strategies. Too much money is lost if elective surgeries are canceled. Absolutely. Most elective surgeries, by definition, are non-emergent. Exactly. And then this is the other piece of that, right? Here's the other piece of that. You've also got, Ballad Health and ETSU are joined at the hip. And many of the physicians at ETSU are doing all of their surgery work in Ballad Health facilities, right? So follow me. If ETSU has their staff where they get a smaller base salary, which they do, and they have to make up a good portion of their income by doing these surgeries, now you have physicians who may not be able to make the money that they were and may say, hey, I don't want to stay in this system. So now you have a situation where what do you do if you have providers that no longer want to provide care at your hospitals because they can't make up their income and then they go other places? You're already having trouble recruiting nurses from other places. But this is what's important to understand. The CDC said you must implement these guidelines in a continuum. You must implement contingency capacity strategies before you can implement crisis. So before Ballad Health, before you can bring back positive COVID staff and put them in your hospital systems, you must cancel your non-essential procedures and visits. Because if you don't, you are not following CDC guidelines. And then you're going to turn around and ask CMS to give you a vaccine exemption. But you're not doing everything possible to mitigate staffing shortages. And you're using staffing shortages as a reason for needing the exemption to the vaccine. And what's crazy about this is the leading premier medical and healthcare facilities that we see are not having this problem. Mayo's implemented their vaccine mandate. Winston-Salem has, Atrium has, right? Duke has. So what is it about Ballad Health that you say you're pro-vaccine, but you can't get your staff to comply. Tell me why you can't get your staff to understand science and medicine. Could it be, could it possibly be that your CEO is so ingrained in politics and politicizing what is a healthcare issue that it is no longer about best practices and the medical standard? Could it be that you've aligned yourself so much with certain individuals and you and the governor are hanging out too much that you can't get your staff on board? This is a problem. And to me, it's so how hard can it be if you are the largest employer and you own all the hospitals in a geographic region the size of New Jersey, why can't you keep employees? Why can't you? Well, I'll tell you what Alan Levine said in an interview with WJHL. Here's what he said. I already gave y'all the link to it, but here's what he said. He said that if the work is going to be this stressful due to the combination of staffing shortages and increased volume of seriously ill patients, the attraction of going elsewhere and being compensated as much as 3 or 4 times what full-time staff nurses are paid becomes too difficult to ignore. So he is saying, listen, they have employees that are leaving Ballad Health to become travel nurses to get paid 3 or 4 times the amount. Well, here's what I don't understand, Alan. What he also goes on to say is that there are more than 600 nursing positions currently open at Ballad Health, and 400 of those are being filled with contract laborers. So what does that tell me? That tells me that you are paying other contract laborers 3 and 4 times what you're paying your regular staff. So instead of having those staff leave to go elsewhere to be paid that 3 or 4 times by some other company, why don't you just raise the salary of your employees, of your nurses, match that travel pay, and get them to stay if it's a money issue? But maybe it's not a money issue. Maybe it's the attraction of going elsewhere. Maybe it's the environment and the culture that they're working in. Maybe it ain't about the money. Because here's what I know, being from this region, knowing the people in this region, here's what I know. I know that there are people who have worked at Holston Valley Medical Center and at Bristol Regional and in that region, knowing they could make higher money other places, but willing to do it because that was home and they were caring for their loved ones and their neighbors and their church members and their friends and their families. And they would rather be at home making okay money than to be traveling away from their loved ones, making even more money. Because listen, our nurses have always had the opportunity to go outside the region and make more money as a traveler. Come on, y'all. They have always had the ability to do that. Correct? So what's the difference? Why are they taking this avenue now? I'm not saying that it's not money at all. I'm not saying that. What I am saying is it both? Because if you're already, Ballad Health, if you are already shelling out the money to strangers and traveling nurses, why not shell out that money to keep the people who live right there in your community? The people whose children go to school there and who you see in church. Why not invest that money in your community? The biggest takeaways from today to me are 2 things. One, Alan Levine is saying out of his own mouth, they are not implementing the CDC guidelines in the manner that they are supposed to. Because according to the CDC, you must implement them in a continuum of care. You are supposed to do contingency before you do crisis, right? It was just updated on the 21st. You do not get to skip over contingency and go straight to crisis. That's clearly what it says. They are meant to be considered and implemented sequentially. That means the very first thing under the contingency is to stop the elective and the non-emergent, non-essential, not non-emergent, but non-essential procedures and visits. That's what it says, right? Hold on, I'm having to block some trolls. All right. Now, when he says to you, listen, we have decided we're not doing that.
We are not going to defer elective surgeries if we can avoid it.
We're not going to do it. We did it once before. The government made us do it another time, but we've just decided we're not going to do it. Folks, what that comes down to is a choice of money over patient safety. That's it. That is it. It comes down to a choice of money over following CDC guidelines. It comes money over the science, money over whatever. And this is not the first time we have seen, historically speaking, Ballad Health choose money over the people. Right, Melanie? So, and Kelly, I have heard that. I have heard that they have that people have been working with COVID for a while now. I've heard that. I don't know that to be fact, but you know, people tell me stuff. There's lots of other things that I've heard that I haven't reported on because I don't know for sure. But this I know for sure. I know because they are so confident. See, this is the problem when you have a medical monopoly. If Alan Levine was still the CEO of only Mountain States Health Alliance, you guys would have a choice. You would have a choice to go to Wellmont facilities. You would have a choice in your health care. But he's not. The state created a medical monopoly, and now you have no choice. My friend Marcia just commented she's getting over COVID and she's sitting at the ER with her mother. She's a caregiver and scared to death. And this is when I get frustrated. You know, I don't feel bad for calling them out. I don't feel bad because what they're doing is not in the best interest of the public, and it's not in the best interest of their staff, to be quite frank. But to me, when you have staff that don't follow leadership, that is a leadership issue. That is a leadership issue. You know, maybe it has to do when this merger was first complete and you topped out nursing pay in certain positions so people could no longer get raises that they were expecting. Maybe it's when you told the whole world that you gave them raises in 2019. Do y'all remember that? Do y'all remember this? In 2019, Ballad Health announces pay raise for nurses. Do y'all remember that? I remember that. You want to know why? We were sitting outside of Holston Valley Medical Center, and I had staff members that brought me their letters, and their raises were 6 cents, 10 cents. I saw one that was 1 cent. But here's the thing, when you cap out other pay and you're not giving the raises and the bonuses that those employees were expecting, you can take that money, divvy it out a little bit to even out pay rates, and all of a sudden you've saved yourself a buttload of money and you've met your COPA requirements. Right. And then it overruns the hospitals through Newport and Knoxville. Like the impact of Ballad Health choices in our region is far reaching in both the Tennessee, Virginia, and North Carolina direction. I literally talked to a physician today who needs a procedure done, and that physician is going all the way to North Carolina to have it done, rather than have it done at a Ballad Health facility in the system in which, runs the whole region. They're going to another state. It's impacting Knoxville. It's impacting Nashville. It's impacting Wytheville, Roanoke. You know what I mean? Winston-Salem and Duke. The impact of this medical monopoly is far and wide in its reach. And all I know is ish runs downhill. Politics has no place in healthcare. No place in healthcare. And there have been nothing but politics in the creation, in the maintenance, and in the decisions within Ballad Health. Right? That's why you had Senator Rusty Crowe change the law so they could be created. It's why they modified the law in terms of reporting so you, the general public, can't even get access to it. We don't even know what the real numbers are, because when you look at their annual report, it literally says that it's considered proprietary information and it's protected. And here's what happens. If you send a FOIA request, the Attorney General's office, Miss Janet Kleinfelter, she'll send you an email and tell you, no, you can't have it. She has 7 days to tell you you can't have it. And then if you really want it and you want to challenge it, you have to take them to court to get it. And if you lose, you have to pay Ballad Health's legal fees. Y'all remember that law, right? Surely to goodness, y'all remember that. It's been a long time since we talked about all of this. And now it's impacting you in the midst of a global pandemic. What do you think, guys? Danny Williams says we're losing so many providers to Carilion and Roanoke and to the hospitals in North Carolina because they're so sick of Ballad shit. We sat in the ER for 7 hours, all people with different issues in the same waiting room, 3 or 4 barf bags, couple of broken bones, and the rest COVID symptoms. And the healthy that takes families to the ER is sitting with all of them. Sonia says, I'm speechless. Folks, this matters. It matters that the CEO of a medical monopoly thinks that they don't have to follow CDC guidelines. It matters that they can say, hey, we have a crisis. We're going to implement this, but we're going to skip over the rest of it. It matters that they provide different numbers depending upon who they're talking to. And you can't get to the truth because that's considered proprietary information and your politicians gave them a law that hides the data. How can you fix it? Deborah, let me just tell you something. If I'm being really, really honest, I don't have the answer on how to fix it anymore. When I came back home in 2018 and 2019, and I said, folks, this is what we got to do to fix it. Because let me tell y'all the real opportunity that we had. July 31st, 2019 was our damn deadline. Because after July 2019, when they finally merged the dollars and the assets all together, it was going to be damn near impossible to break it apart. I don't know what the solution is now. Like what I said before is your legislators, let's be clear, your state reps and your senators in the state of Tennessee, they can pass legislation. They can modify the legislation surrounding a hospital authority, and they could create one. They could create a hospital authority. And if they did create one, they could say to Ballad Health, listen, we would like for you to voluntarily turn over your oversight. So instead of a board of directors, we would like for this hospital authority to oversee, right? And then the question would be, why would Ballad not do that? Let me tell you another thing, nurses, while I'm talking to y'all, let me just tell y'all something. Here's the problem that you're in right now. You are having to choose to leave the region, become a travel nurse, make more money somewhere else because you have no bargaining power. The only thing that you can do right now is ask Ballad for some more money, and if they don't give it to you, leave. But if you nurses were unionized, you could not only negotiate your dollar, you could negotiate your working conditions. Because let me just tell you what happens when you have a mass exodus of staff. It's the same thing as a strike. The impact is the same, right? That's basically what you guys are doing, but you don't have the leverage. When we talk about staff are leaving because they can be paid other places and they it's attractive for them to go somewhere else, and that so many of them are doing it, well, that's the equivalent of a strike, folks. Listen, according to Ballad Health, according to Alan Levine, he told WJHL in this article that they have 13,000 employees approximately. Well, y'all, we know that when the merger took place, they had 15,000. So what happened that you lost 2,000 employees in 4 years? What happened that you lost 3.5% of your workforce every year? What happened? And here's the thing, you nurses, I am telling you, as sure as I'm sitting here in this seat, if you want to negotiate and actually have some power, you might want to unionize. And I'll tell you this, I've actually talked to the union folks for you. I have. I just don't know if y'all have it in you. When we talked about it before, some of you all signed up on the form. I've got over 300 of you. I've got over 300 employees, nurses, that said, yes, I want a union. But at the time, most of y'all were too scared to do anything. Now, a lot of y'all have left. A lot of you want to leave. Here's the question. Those of you that left, do you want to come back? Those of you that are still there, do you want some actual leverage? Do you want to be able to negotiate for safe, productive, effective working conditions and good pay? Because if you do, you might want to get a union. You might want to unionize. Y'all want me to be your union rep? Y'all know if I become a union rep, they can't keep me out the hospital. Y'all know if I become a union rep, they can't keep me from talking to you. Did y'all know that? Y'all want me to go get with one of these nursing organizations and be your union rep for Ballad? Y'all want me to do that? Huh? Is that what I need to do? Here's the thing. Here's what I'm going to ask you. Are y'all really going to do it this time? If I If I contact a union and I become a union rep, are y'all actually going to step up to the plate, not be scared, and do what you need to do? Because I can't unionize for you. I cannot unionize for you. A lot of y'all thought I was going to save the world sitting outside of Holston Valley Medical Center. I can't do that by myself. It takes you. Show me y'all going to do it this time. I want you to have stellar health care. I want Southwest Virginia to have a NICU that isn't an additional 30 to 40 minutes, 45 minutes away. I want you to be proud of your healthcare systems and hospitals anymore. I want you to have those things again. I want you to have leadership that you can trust, leadership that values you. I want you to get paid your worth. But me wanting it for you ain't gonna make it happen. Same thing, guys. If you want another NICU, if you want competition in the region, then y'all need to get rid of that certificate of need. You need to be calling up your politicians. You need to be saying, hey, these are bills that need to have, these are bills that y'all need to pass for us. They work for you. So make them work. Anyway, y'all let me know if y'all really serious. If y'all really want to unionize, if you really want to fix your health care, let me know. I've rested a little bit. Cammie, you know, like I said, when I put up a website at one point for people to register if they wanted a union, and over 300 of them said they did. 2 said no. Everybody else said yes. If you mean it, then do something. What I do know, and I'm literally logging in right now so I can see something. What I do know is that it is not okay for the CEO of a medical monopoly to stand in front of all of you all and say, we have a staffing crisis. We're going to implement these crisis guidelines from the CDC, but then ignore the fact that the CDC said before you can do that, you must use contingency. You must cancel non-essential, surgeries and procedures. And for the CEO to be able to sit there and say, nah, I just don't think we're going to do that. We've decided we're not going to do that. Thanks, but no thanks, CDC. We don't want to do that. Right? Let me just look real quick. Union. I'm literally pulling up. Oh, and some of you all might be gone. So let me just tell y'all, I cleaned out some of my database today for people who they weren't active on my email list anymore, and they weren't either opening emails, or the emails were hard bouncing, or people who had unsubscribed. So currently right now, I have 249 of you. I'm literally looking at the number. I have 249. Yes. So Kia, of course, they can be reported to the CDC, which I tweeted the CDC today, along with the clip of Alan. I did that today. And yeah. So yes. And they can also be turned into the Centers for Medicaid and Medicare. So listen, Alan Levine has sent this letter to CMS saying, listen, give us a vaccine exception, right? That's what he said. And he cited their nursing shortage as a reason for doing that. But he just stood on television today and said, we are not implementing all of the contingency mitigation, guidelines that we could to prevent this. That's what he said, right? So surely to goodness, CMS would want to know that, right? CMS might like to hear him say what he said today. He said he intends to be very liberal with religious exceptions for this vaccine mandate. I'm sure CMS will want to know that, since he's begging them for an exemption, saying that Ballad Health is doing everything they can to make sure people get vaccinated, when in fact they're not. Yeah, you have to have over 50% of the nurses. You have to have over 50% of your nursing population say yes. And here's the thing. If the majority of Ballad Health nurses are now contract nurses, it might not take that many. It might not take that many people. Y'all follow me? Because your contract nurses, they don't count. So if, like what Alan said in this WJHL interview, there were 600 open positions for nursing and 400 of them were filled by contract nurses, right? Might not take that many. It might not take that many Ballad nurses to step up. And I'm going to tell you right now, Centers for Medicaid and Medicaid can absolutely take care of this. You want to know why? Because 70% of Ballad Health patients have Medicaid or Medicare. So that's where the majority of their money comes. I'll tell you what else you can do. With the Tennessee Department of Health, there's a division called the Centers for Licensure of Healthcare Facilities, right? So if you believe that the healthcare facilities are doing something that is, goes against best standards of care, goes against, guidelines, laws, requirements, any of that, you can report those hospitals and healthcare facilities, and you can do it anonymously if you work there. You can do it anonymously if you don't work there, or you can do it with your name. They will give you a number and they will actually follow up and tell you the result of your complaint. How do I know? Because I've done it a couple of times. Do you all remember two springs ago when they had the cardiac patients that were dying? Do y'all remember that? And Lindy White went on TV and said, no, it's not a sepsis-like condition or whatever. Do y'all remember that? Because I filed a complaint. And the letter that I received back from the Department of Health said that they did in fact find that Ballad Health had broken regulations and laws. That's what they said to me in my letter. Y'all know I got it in a box in there. So you can do something, but you got to want to do something. Okay? That's it. I'm tired. So again, this is where we are. So what can you do with this information? You can contact CMS. You can contact the CDC. You can contact the Tennessee Department of Health, and the specific department is the Licensure for Healthcare Facilities. So Kia, they do not tell you what action they took until after their final report comes out. And to be frank, by the time COVID and all that happened, I didn't even go back to check. The last time I checked was before that, and they hadn't actually implemented. So it has to go through this process before it becomes public knowledge. So, but y'all need to know that it appears Ballad Health is not following CDC guidelines in this decision. It appears that they're not. And, you don't have any other choice for your health care. And that matters. The bottom line is, by Ballad Health saying we are in a crisis staffing situation, they are admitting that they cannot provide safe care right now. That's literally the standard. Y'all remember that, right? Here's what the CDC said. The CDC said right here, in order to implement the crisis part, here's what it says. When staffing shortages occur, healthcare facilities and employers may need to implement crisis capacity strategies to continue to provide patient care. When there are no longer enough staff to provide safe patient care, then you can allow asymptomatic healthcare providers to now come back to work, basically. So that by them saying that, they're saying, listen, we don't have enough to provide safe patient care. What does that mean for those of you all who live there and you have no other choice for your care? You're welcome, Carmi. All right, I'm out of here, folks. Hopefully this was beneficial to you and you do something with the information. Nurses, if you really want to unionize, let me know. Let me know. I've got the folks for you to talk to. But you can't hide behind someone else. You have to take a stand for yourself. You guys have to contact your politicians. You have to get rid of your certificate of need. I mean, you don't have to do these things. What I'm saying is that if you want change to happen, you have to take ownership of it. And you have to push for the change that you deserve, because you do deserve it. Just like Bristol deserves clean air to breathe, the entire region deserves access to adequate, safe health care. I have said that from the beginning, and I say it now. Okay? All right, I'm out of here, you guys. Be safe, for goodness sake. Please physically distance, wear your mask, wash your hands. You guys have a positivity rate of 47% right now. Almost 3,800 of your neighbors have died in the last 22 months. Come on, y'all. Step up. Okay? I'm out of here. Be amazing, be light, and be love. Peace.